It should go live. Yeah, so it should say on your screen whether we're live or not. So we are live now. To everyone out there watching, hi guys, my name is Chris Channa. I'm one of your local senior care experts here in Charlotte County with Lauren Sutherland, who is the quality care manager for the sepsis program at Fawcett Memorial Hospital. Lauren, thank you for joining us today. Thank you for being with us. And just thank you for providing this knowledge, this information for people. Really appreciate it.
Yeah, you made my title sound fancy and long. I appreciate that. Like that.
Well, you are official. I know you have a lot going on right now. I can only imagine in your guys' world. Thank you to literally everyone at Fawcett and all the superheroes in the healthcare field right now. You guys really are. I mean, it's a lot to take on emotionally, mentally, physically, the whole thing. And so I feel for everyone in this space just because of that unknown, the uncertainty. And so I just appreciate you taking the time to just share with people and tell us a little bit about your world,
Yeah, I'm grateful to be heard. I feel like I'm just a desk nurse these days because I'm not on the front lines actually taking care of people anymore. So it's exciting to have anybody want to hear about, some of the stuff we're doing at Fawcett, and also in the year of COVID, how that's kind of tying into sepsis care and what we're doing on a community level and at the facility level to make sure that we're taking good care of people, because it's pretty relevant with everything going on right now.
Absolutely. Like when you think about like just for those that don't understand what sepsis is, what I guess what's the easiest way to describe or help people understand what sepsis is?
So sepsis is the body's overwhelming response to an infection, and it can be any type of infection. So a bacterial infection, like an infection that causes pneumonia, can cause sepsis and maybe cause your respiratory tract to shut down. Or sepsis can be caused by a virus like COVID-19. Sepsis could be caused by a fungus or a parasite. So depending on what type of cootie is causing the sepsis, there's different treatment recommendations.
Gotcha.
And up to this point, we really focused on the bacterial portion because there's very specific treatment guidelines for bacterial sepsis. We have very strict protocols and guidelines that we have to follow for bacterial sepsis. However, right now the hot topic is COVID, and our community members are being affected by COVID.
Right.
And guidelines for sepsis from COVID is there's not enough research to know what the perfect treatment regimen looks like right now. It's kind of person by person. We don't have a pill. We don't have a magic medication. So we're kind of going through that with everybody who's coming in with these issues and trying to figure out for this specific case, what's the best outcome going to be and what can we do to help them. With viruses, a lot of times it's symptom management and ensuring they don't get any secondary infections as a result of their initial viral insult, if you will. So we're on the journey with you.
Right. Is like, so when you think about sepsis though, in the past, the way you've treated sepsis, is it typically, so sepsis is it the immune system responding a certain way to an infection, or is it the infection that's like taking over?
Yeah, everybody's immune systems kind of tick a little bit differently, and everybody's body creates inflammation based on infection. And the more inflammation that's created, unfortunately, the worse outcomes you can have. So it's all about this cascade of inflammation, how long it takes, how serious the virus is, and also, unfortunately, how many comorbidities somebody has. So if they're a diabetic, or if they have asthma, or if they're overweight, or if they smoke, these things
Right.
kind of all trigger how that infection is going to affect that person and how badly, how sepsis could potentially adversely affect them. So
Gotcha.
It's a really huge picture when you start talking about it like that.
Gotcha. Sure. So I guess when you think about sepsis management, are you trying to manage the infection, or are you typically trying to manage that immune system response?
Both, right?
Okay. Gotcha.
So with bacterial sepsis, which is our claim to fame, right? It's what the medical community has really homed in on in the last while anyway. Once we realized what sepsis was, everybody kind of called it a lot of other things, organ failure from infection, and then we kind of put a name on it, which was sepsis.
Sure.
And when we talk about bacterial sepsis, which is pretty, I don't want to say common, but relatively common, we have great protocols in place that are evidence-based and we know work. And so administering early antibiotics by an IV, giving large amounts of fluid boluses, drawing blood cultures, and measuring other laboratory results are things that are tried and true and we've always done. People are coming into our hospital now with viral infections like COVID and experiencing respiratory distress and respiratory failure from COVID, where they're needing a tube to help them breathe. And really, when you get to that point, an antibiotic isn't the key. We're trying to figure out how to manage those symptoms and keep down inflammation and get that person functioning on their own again, and not letting them develop another subsequent infection from us or from another hospital, another person in the hospital or anything like that, keeping them safe. So it's definitely a different landscape depending on what we think the cootie is causing the problem.
Gotcha. So now, just kind of thinking about just sepsis when it comes to like people getting it. Is there a certain like the people that are getting sepsis? Is it something that do people get it often? Is it something that usually comes at the end of like a antibiotic cycle?
Yeah.
Is there
So one of the most frightening parts about sepsis is that it doesn't have a type. It doesn't have a specific niche of people that it's going to affect. It can affect anybody from the really young to the really old. So just because you're 20 years old and healthy doesn't mean that you aren't going to potentially get sepsis or get sick. And the thing that we do know is that folks that have comorbidities or are immunocompromised are always at higher risk. And if you get sepsis once, you're at higher risk for getting it again in the future with subsequent infections. So it's like a double whammy, right? Like we don't really know who it could affect or who it couldn't affect. And if you get it once, you're in trouble because you could get it again. So we can't predict. We can only predict risk. We can't predict like definites of who's going to get what.
Gotcha. So like, is that something like in someone's chart? Is it important for someone to know or to at least make like other healthcare folks know that they've had it before, so maybe that they treat that sepsis differently next time?
Yeah, it's super significant to know that. It's sort of like when you come in for a procedure and they ask like, oh, have you ever had a reaction to anesthesia? And they have to answer the question, yeah, I was fine, or no, they couldn't get me off the vent. I had a really hard time. I couldn't wake up. Or it's the same type of thing. If you've had an infection that led to organ dysfunction in the past, we need to know that because it's taking you up to a higher risk category.
Gotcha. Yeah. Now is so that means that so it's important for no matter what, for someone to it's almost like have an analogy, like letting people know this is something, I've had, these are my allergies. I've had sepsis. Here's just information about me. Right.
My mom said the sepsis. She calls it the sepsis, which I think is kind of funny. Like the sepsis, as if it's a more specific.
Sure. But now, like, how would someone be able to self-diagnose whether or not they have sepsis? Is that something that like people would be aware of? Like, hey, I'm having a sepsis episode if they've never had it before, or how do you know that?
It's funny that you say that because if you're my mom, she self-diagnoses everything without medical guidance.
Right.
So that's. I don't recommend that anybody try to self-diagnose themselves with anything. I'll always tell you, you're better off getting the advice of a medical professional. However, there are signs and symptoms to look for that can lead you in the direction of, I'm in trouble, or maybe I'm okay and I can manage this at home. So what I like to tell people is they know their body best, and if there's something wrong, they probably know something is off and they should take that seriously. But the things to look for at home, any type of infection. So symptoms of an infection are usually pretty obvious to most people. So a high or a low temperature. So a temperature above 101 or below 96 are pretty significant. And in this case, a low temperature is just as scary as the high temperature. So a lot of people are worried about those burning 105-degree temps and whatever, but a low temperature is just as significant. We're looking for rapid respiration, so breathing very quickly or breathing more than you typically, or quicker than you typically do, is significant. Anything over 20 respirations per minute gets our attention. But you also have to consider, if somebody's got respiratory disease in their regular life, they're probably going to breathe quickly anyhow. So anything outside of your norm.
Right.
Rapid heart rate. So a heart rate above 90 typically gets our attention.
Okay.
But if you're someone who's got a rapid heart rate anyway, again, you have to look at what your baseline is. And any kind of confusion, not knowing where you are. Obviously, you wouldn't know if you wouldn't know, but maybe your mate or your roommates or your family would know those things about you if you're more confused than normal. And that's when it's time to get a physician involved and to see if there's something more that you can do.
Do you think, do people know like ahead of time sometimes whether or not meaning like is there, do they need to have an infection to know do they need to have, like, for instance, someone has a UTI or someone that has an infection in their, and maybe they had a surgery and they know they have an infection, like, do they need to? Okay, gotcha. So you can get
super obvious, like they have a wound and it looks not pretty and there's drainage coming out of the wound and you're like, like Yahtzee, I got that. But sometimes it's just as simple as, like, maybe they're not urinating as much as they normally do, or they're not able to control their bladder, or something that's a little less obvious. They don't know that they have an infection. And also intra-abdominal things can be a little tricky. The patient just will present with pain, and we work them up as an abdominal pain, but subsequently after imaging find that there's something in the abdomen that maybe has ruptured, and that's a pretty serious incident that can happen with, like, small bowel obstruction. So if a patient isn't moving their bowels regularly or something like that, those types of instances can happen. So it's a variety of places where it could develop, and the patients don't always know what it is. They can name the symptoms, but they can't really put their finger on it. Well, I for sure know I have an infection. They don't always know.
Sure. Now, is there a certain specific, like, treatment regimen for folks? Like, so even if I'm suspecting something, I'm going to go seek medical advice. But then, is there a certain regimen that people or that you guys would take in the medical community? Like, is it pretty standard as far as, like, here's what we do, this is the process that we take you through, or is it really kind of specific to each individual?
Yeah, it's very specific. So at our, and I can only speak to our specific facility, but if someone comes in and we joke, like, even if they so much as whiff as infection or sepsis, we sort of go down this rabbit hole, and it's the same items every time. We draw lab work, very specific lab work, typically your metabolic panel and your CBC, your complete blood count. But we also are looking at something called a lactic acid, and a lactic acid measures global tissue hypoxia. So if cells are not getting oxygen, that's what a lactic acid measures. That's one of the first things that we look at. We see what that number is, and we base fluid administration on that lactic acid number in addition to your blood pressure. If your blood pressure is going down, we're going to give you fluids as well. We're going to draw blood cultures because we have to make sure that you're not growing cooties in your blood from your infection. So in addition to those that we draw, we're going to grab a couple sets of blood cultures, and we're going to give you IV antibiotics. And the IV antibiotics are broad spectrum, so they cover a lot of different types of cooties, because until we know what kind of cootie you're growing, we have to give you something that kind of covers the rainbow, if you will. So it's the same every time, and we try to get that done in an hour.
Wow, gotcha. So really, like, this is something that you're trying to mitigate or like stay on top of, like, immediately, because does it typically, the sepsis, like, grow really, really fast? Does the is it something that you need to take care of immediately, like almost like a stroke, or is it?
It is. We are trying to educate the public that sepsis is just as much of an emergency as a heart attack or a stroke.
Wow.
People don't think about treating sepsis that way. However, recent studies have shown that every hour that you delay treatment can increase your mortality up to 8%. Wow. So if you sit at home for a few days and wait, and then you reluctantly come into the hospital and wait or whatever, the longer you take, the higher risk you are. And if you think about the comorbidities that our population has, the sicker you are, the higher risk you have for potentially, having trouble from these types of infections. So we take it really seriously. We treat it just like a stroke or a heart attack. There's specific team members that do specific items for those. We call them sepsis alerts.
Right.
And we want to work fast because we want to get that patient. Typically, if you can get them with their fluids and their antibiotics, you reduce the risk of them having to go to ICU, and hopefully reduce the risk of them having to be there a very long time. Maybe it's something that we can watch them overnight and send them home the next day with oral antibiotics, or maybe not, and they need to stay a couple days and get imaging and treatment. We just don't know. It's so different case by case, but the one thing that's true every time is that you want to treat fast.
Sure. Is that something now, when it comes to that, is that something that's contagious potentially, or is it something that it's really individualized per person? You can't catch it from somebody else, or does it depend on the?
Right. Can't catch the sepsis.
Okay.
So sepsis itself is a syndrome associated with an infection. So you're not going to catch sepsis from somebody, but whatever their infection is could potentially be transmittable. So in the case of pneumonia, and you have sepsis from pneumonia, you could potentially cough on somebody and give them the cootie that caused your pneumonia. However, you're not going to give them sepsis, because sepsis is the syndrome of inflammation associated with that infection. So if you get pneumonia and I get pneumonia, we're going to have two different reactions to it. You might get sepsis, I might not. But
Gotcha.
The infection itself is transmissible, of course.
Gotcha. So you might, the way you treat sepsis and the way you're treating, the way each infection might, be transmittable, it might be different. So it's almost like you're really you're taking care of two different things, because the sepsis could potentially be caused by something else, some other type of infection, and you might treat that infection differently than this infection type of thing.
You are spot on. Do you want a job? I mean, you're getting it.
I just sometimes I gotta say it out loud to kind of reason in my head, to understand it, So so no, I appreciate that information. It's very, very insightful, because it's definitely something that I think is complicated if you're not in the medical field, or you're not aware of this information. What do you, I guess, what's typically, when you think from an educational standpoint, or just even yourself as an expert in this part of the field, what do you typically advise people? What type of information do you think would be helpful for people to know outside of what we've covered?
So outside of just the signs and symptoms like we talked about, like the fever, high or low temperature, fast heart rate, fast breathing, confusion, just changes from people's baselines.
Sure.
I want people to know that they need to wash their hands, which seems very simple. And in this COVID pandemic, we've actually gotten a lot more attention to hand washing. But I will say it again, washing your hands is a great way to keep you and your family a little safer. The other thing I would say is take advantage of our county resources and call 911 to get transported to the hospital if you're experiencing a medical emergency. People are very afraid to call 911, and especially with the pandemic going on, people are kind of terrified of using resources, but they don't have to be, because our priority is keeping everybody safe, and EMS is with us in that journey, and they are not in a position where they're going to put you at risk for catching something else. They're on the same train as we are. They're sanitizing like we are and using masks and being safe, and it's much more frightening to have a sick patient trying to drive themselves to a hospital than if they would just use their resources. So I encourage people to call 911 with a medical emergency, and that's your strokes, your heart attacks, sepsis, anything that would alter your judgment, or you have pain that would keep you from being able to focus on driving. Please use EMS because they also give us a heads up. They call us when they're picking up a patient and they say, "Hey, Lauren, I'm picking up Chris. I think this is sepsis," because we work with them and train them to look for certain. But we know they're coming then, and we can prepare our staff for that patient.
Gotcha.
Well, the third thing, getting your immunizations, your flu and pneumonia vaccines as recommended by your physicians are significant. And I feel like it's something that's kind of glossed over. But if you are a candidate for those things, I would always recommend your flu or pneumonia vaccine. And just, pretty basic, boring stuff like getting 8 hours of sleep and eating fruits and vegetables, which is really not very exciting to talk about. But sleep cures people, I swear. I would recommend a good night's sleep to anybody.
Yeah, absolutely. Is it when you and we were talking about earlier in this, and just to better understand, when you were talking about the bacterial side of it, like how the sepsis is a process for like the bacterial side. Is there a process for then like the viral side? I know COVID specific is different, but for viruses in general, like is that a different type of treatment process or a different type of diagnosis?
Yeah, so sometimes we will still cover with antibiotics. There was a small study done in France that said that Zithromax was helpful for patients with COVID-19. We also look at giving vitamin C and steroids. There's also the drug Plaquenil that you hear folks on TV talk about. So there are some options out there that people have discussed that might be effective against COVID-19, but we really don't have the type of evidence to say that it's the standard of care. And as this viral train keeps going down the tracks, people are probably going to do more research, and then in a few years from now, we'll probably have a much clearer picture of what that treatment regimen will look like. But right now, there's really not. It's a symptom control and watch and wait, because
Gotcha.
there is, I mentioned, there's just no magic pill.
Right. And it's something that's like, everyone's learning almost daily. I'm sure every hospital is almost coming up with their own techniques, like what works best, what doesn't work, and things like that. So I can imagine.
I'm sure, everybody's just trying to see what cocktail kind of works the best and has the best outcomes for patients.
Absolutely. Any kind of last words of advice or just tips or anything that you think would be helpful for folks? Or I appreciate everything you've shared with us today. It's been it's very, very insightful information. I'm sure anyone can learn from this. This is great information. So thank you for sharing. But
so kind. Besides washing your hands, getting a good night's sleep, and eating well, continue to maintain your social distancing. I know that people are saying, we're ready to open this country back up, we're ready to go, but I want to warn people that it is likely that we are going to have many more weeks of kind of the back and forth dance of COVID. Please continue to maintain your social distance and try to do the right thing, not only for yourself, but for your community. And what else could I say? Did I say wash your hands?
Well, that's wonderful. No, I can't thank you enough for everything. Seriously, this has just been great information. Super grateful to you for sharing with us today, making us aware of these things. So thank you again for that, Lauren, and really appreciate everything. So appreciate everything that you and your entire team are doing at Fawcett Memorial Hospital. And I know we were going to give this a little bit more in-depth presentation at our conference, and I look forward to getting back to that, here soon at some point. But obviously, we're going to respect that social distancing, and we'll get to that someday, and when it's safe to do so, and look forward to having you then. So
I look forward to it. Thank you guys for having me, and we're here for you. Anybody who needs help, we're ready for you, and if you're safe, to come here.
Awesome, wonderful. Thanks so much, Lauren. Appreciate it. You guys have a great day, everyone. Thanks for joining us today.